The COVID-19 pandemic has had a significant impact on global society, affecting communities, economies, and healthcare systems all around the world. COVID-19 developed in late 2019 as a highly contagious respiratory illness caused by the novel coronavirus SARS-CoV-2 and quickly spread across the globe, causing enormous health, social, and economic effects. Health effect. Millions of people have been infected by the virus, resulting in a huge number of diseases and fatalities. It has placed a huge strain on healthcare systems, especially those with little resources and infrastructure. COVID-19 has been shown to produce severe respiratory symptoms ranging from moderate to life-threatening. Individuals with pre-existing health issues, as well as the elderly, are especially prone to severe sickness and death. Long-term health impacts of the virus have also been discovered, including respiratory difficulties, organ damage, neurological complications, and chronic symptoms described as long COVID. Social impact. The epidemic has demanded stringent public health measures, such as social isolation, lockdowns, and travel restrictions, which have had an influence on people's daily lives and social contacts. These procedures were designed to limit viral transmission and safeguard vulnerable populations. Closures or restrictions have been imposed on schools, companies, and public spaces, affecting education, employment, and leisure activities. For many people, remote work and virtual learning have become the new standard. Because of variables such as fear of infection, social isolation, and economic instability, the pandemic has created psychological distress, including higher levels of stress, anxiety, and depression. Economic impact. The epidemic has caused a huge decline in the worldwide economy. Businesses in a variety of industries encountered closures, curtailed operations, and financial difficulties. Many people have lost their employment or had their income reduced. The availability of products and key supplies was impacted as supply routes were interrupted. Travel, tourist, hospitality, and entertainment industries were particularly heavily hit. To minimize the economic damage, governments enacted fiscal and monetary measures such as stimulus packages, financial aid, and support programs for affected firms and individuals. Healthcare systems. The epidemic put an enormous strain on healthcare infrastructure, resulting in a lack of medical supplies, hospital beds, and healthcare workers. Efforts were made to enhance testing capacity quickly, produce vaccinations, and dedicate resources to treating COVID-19 patients. Telemedicine and remote healthcare services have grown in popularity to provide healthcare while reducing the danger of transmission. Scientific advances. The pandemic of COVID-19 prompted unprecedented global collaboration among scientists, researchers, and healthcare professionals. This collaboration resulted in faster vaccine development, better diagnostics, and more treatment alternatives. The pandemic underscored the significance of a strong public health infrastructure, surveillance systems, and worldwide collaboration in responding to emerging infectious illnesses. Societal changes. The epidemic prompted the broad use of remote work, virtual meetings, and e-commerce, fundamentally altering how people work, interact, and conduct business. Hygiene procedures like as frequent hand washing, mask use, and surface sanitization have become critical preventive measures. COVID-19 also highlighted and worsened existing social inequities, such as gaps in healthcare access, income, and education. Vaccination drives. COVID-19 vaccines have been produced and deployed globally, providing hope for curbing the virus's spread. Vaccination initiatives were designed to create herd immunity and safeguard vulnerable people. During the pandemic, vaccine distribution, vaccination reluctance, and equal access to vaccines were major concerns. The COVID-19 pandemic is a sharp reminder of the significance of planning, effective risk management, and global cooperation in dealing with complex health crises. It has hastened innovation, transformed societies, and highlighted the importance of resilient healthcare.